A few weeks ago, I had filmed a skincare video, and in the video, I had floated the idea of having a dermatologist on the channel answer your questions related to skincare. And today we're doing just that. I had the privilege and honor of sitting down with Dr. Sanjay Agarwal, who is one of the most sought after dermatologists in Calcutta. Dr. Agarwal currently practices in Calcutta at CMRI and also at Wisderm Clinic. Dr. Agarwal has had a decade of experience practicing in England as a senior consultant dermatologist, and I was fortunate enough to sit down and have an interview with him where I asked him all of the questions that you left me. I've tried my best to include most of your questions that were in the comments. If your question was left out, then don't feel disheartened because this is definitely not the last time we'll have Dr. Agarwal on the channel. This is going to be a long video, so definitely grab a snack. And to make things a little easier for you, I'm going to put all of the timestamps as a pinned comment, and I'm also going to leave them as chapters, so you can definitely check them out as per your convenience. So with that out of the way, let's get straight into the interview. Today we have Dr. Agarwal with us. Dr. Agarwal, thank you so much for being on the channel and gracing us with your presence. And we have a lot of questions for you. So the first question is, what is the best treatment for blackheads?
Well, you see, blackheads, they are something which happens to everybody. And they are by itself not a major medical problem, though I admit that it's a cosmetic issue. So blackhead is basically build-up of the gland cells which pop up on the skin, and you need to have an exfoliation. That is the primary thing we say. And exfoliation can be of many types. For example, you can have a chemical exfoliation, you could get a microdermabrasion, or you could go to one of the cosmetic clinics and get some chemical peels. So I think it depends on what you should first try. And initially I think a gentle scrub, maybe with charcoal or maybe with salicylic acid, which are readily available in the market. You try that first, and then if they are very resistant, then you can go for the next sort of procedures that I have already said, like peels or dermabrasion or various types of lasers that we do sometimes. But I think first things first.
Alright, so we'll come to the next question. So the question is, which sunscreen would a dermatologist prefer? A physical or a chemical sunscreen, and why? And since we're talking about sunscreens, is there a difference in what you would prescribe based on different skin types?
Yeah, I mean, that's a very good question actually, because I get asked this question almost every day, many times. And the first thing I tell my patients is that whatever sunscreen you buy, you must use it. A lot of people buy very expensive sunscreens. They are too expensive and they keep it on the shelf and don't use it. So my first plea to everybody is that if you buy a sunscreen, you should use it every day. And the second most important thing is, don't be stingy. Use enough sunscreen on the fingertip to cover the full face. That is two most important things I will tell my patients about sunscreen. After that, you have to then choose and pick the ones which suits your skin. So it's not that one sunscreen will suit everybody, or even that one sunscreen will suit one person all the time. So, different times, different sunscreens. But the main thing I would say is look for what? One is the SPF, obviously. Now again, some myths here. We think the more the SPF, the better. Well, I would say that if you have an SPF of around 25 or 30, that's good enough. And over that, it should also have a total sunblock mention, which means UVA and UVB. So that is very important to check for SPF and the total block. And then it's very important that you choose a sunscreen which you like. It's no point me telling you a sunscreen and then you don't like it because it's too oily, it's too shiny. So try a few things, get the small samples from the store, try it out, and then pick one that you like. That is my honest advice to all my patients and to you people as well.
So to make it a little easier for our viewers, if you had to choose a sunscreen for oily acne prone skin,
Yes.
which one would you recommend?
Yeah, I mean, if you have an oily skin which is acne prone, obviously you don't want a very physical sunscreen, because then the zinc oxide particles will then actually block the pores and make the acne worse. Then you will use a chemical sunscreen which will help in coating the skin smoothly and not causing the blockage. But over a long period of time, we prefer physical sunscreens because they are more gentle on the skin. So it's again a choice that has to be made depending on the skin type and the underlying skin problems if they have any.
So that is one for oily acne prone skin.
Yes.
And what about very dry skin?
Yes, now for very dry skin, you have now moisturizers which have an SPF, which is very good. So a lot of these ranges that I have seen over the counters, they have a moisturizer with an SPF of 15 or 20 or 25, which will suit most people who don't have a medical condition. But say you have a sun sensitive skin and you need to have a sunscreen which actually blocks the rays, then I would say use a lotion based sunscreen rather than a gel, and use SPF around 30 to 50 in the range, and that should protect you from the harsh rays completely and also not be too harsh on your skin.
Okay, all right. So the next question is, which serum or active is best for acne?
Yeah, I mean, what I tell my patients or what I prescribe is mostly gel-based preparations. Serum is actually a combination of water, oil, and the active product. Now, if you make it more towards the water-based product, then it becomes like a gel. And I prefer gels over serum in acne. For acne, the serums or the gels I prefer would be one with a retinol based preparation, some antibiotics like clindamycin. I don't prefer salicylic acid as a leave-on product, because salicylic acid, lot of preparations in gel based are available, but what they do is they tend to stay, and over a period of time they will cause an irritation. So salicylic acid is good for face washes or for chemical peeling, but for leave-on products I prefer retinoic acid and the antibiotics like clindamycin, nadifloxacin. Then you've got others like niacinamide. You've got a lot of other anti-acne preparations which we use depending on the range, the severity, and the previous results with whatever they have used in the past.
Okay, all right. So the next question, okay, this is regarding hair. The question is about hairlines, a receding hairline, but in the case of females. Why does this happen, and are there any ways in which we can rectify the situation?
Yes, thank you for that. I want to explain why people think the way they think. Now, broadly speaking, we have two types of receding hairline. One is the male pattern and the other is a female pattern. So, I'm glad that you asked this question, because a lot of people think that the receding hairline is mainly a problem with men, and women tend to have thinning rather than receding hairline. But I would like to say is that, you know, receding hairline or male pattern baldness, which we see in men primarily, can also be seen in a section of women, and that is actually interchangeable or overlap phenomenon, which means that you do have male pattern baldness in women and female pattern baldness in men, and this is certainly not any abnormality or hormonal problem, but just a fact of nature. Yeah.
Okay, all right. And is there anything that we can do that is non-invasive?
Yes, certainly. I mean, for receding hairline, the most important and gold standard is minoxidil. A lot of preparations in the market, but the main thing is a percentage. You know, the percentage should be around 5% for men and 3 to 5% for women. And really, we don't want to be going to 10%, which is certainly available over the counter, and I would warn people not to go beyond 5%. Apart from minoxidil, there are other products for the hair, things like biotin, peptide, growth hormones which are available, which do help with the general growth. But for the receding hairline, minoxidil. In men, finasteride, which is a tablet, a hormone tablet which has to be given under prescription. And then in certain cases only, very rarely do we go for PRP, which I'm sure we'll discuss again later.
Okay, all right. So the next question is, I have acne scars from the past 5 years on my face. I've tried many treatments, but it's not working.
Thank you for the question. I mean, acne scars, it's a little broad term for me. I would like to say that acne scars can be either atrophic, which means that they are depressed, or hypertrophic, which means they are above the skin. Now, if it's atrophic or like dips in the skin, then we have the ice pick scars, which are sharp, deep digs in the skin, or box scars, or rolling scars, which are different types of scars basically. Now, depending on these various types of scars, which has to be assessed by a dermatologist, then we give treatment. The most simple treatment for acne scars, believe me, is time. If you leave the acne scar, nature does a wonderful job. At least I don't touch a new acne scar for at least a year. After a year, I will go in with lot of consideration and maybe give something like a gel like retinoic acid and wait. If that doesn't work, then we go for simple treatments like maybe peels or dermabrasion to try and elevate the scar. If that doesn't work, and only if that doesn't work, we go for lasers. Lasers are sprouting everywhere, but we do have to be careful. They can cause more damage, more side effects. So please do the needful, find out the right place for you, and then go for any invasive treatment like laser or surgery. And believe me, time does heal. Believe me.
All right, so the next question comes from Alicia, and Alicia is quite a regular in the comment section, so I want to shout you out. All right, so Alicia's question is,
I have combination and acne prone skin. I have been using salicylic acid for the past 5 months, not too frequently though. Niacinamide and alpha-arbutin are the other actives that I use. The acne leaves brown spots, so alpha-arbutin has been helpful. However, the bumps on my cheeks and whiteheads just won't go. I don't have a fancy sunscreen. I either use Lakme or Neutrogena. How can I treat the bumpy texture and whiteheads?
That's a very good question, Alicia, because we do see many patients with this problem, which is a paradoxical problem. And that is that they have a T-zone which is oily and the sides of the cheek and the forehead which is dry. So obviously, if you give a salicylic acid face wash, that is going to cause dryness and irritation on the other parts of the skin which is not oily. And secondly, if you don't treat the bumpiness, they will form boils, they will form cysts, and then they will leave you with a nasty, ugly scar. So talking and thinking about your skin, I think you need a gentle skin cleanser. You get an oily skin cleanser like salicylic acid, or you get a gentle skin cleanser. And you should use a gentle skin cleanser twice a day. Secondly, yes, niacinamide is a wonderful product. It is non-irritant, which is very important. But I think you do need a retinoic acid. And my one for you would be adapalene, which is not as strong or as irritant as a retinoic acid or Tretetnoin, but adapalene, short contact. For example, use it in the evening, and use it for an hour, and then just remove it with a face wash, and that should help with the acne without causing the irritation that you sometimes experience. Now, the marks that you were talking about, the brown marks. The brown marks, arbutin, kojic acid, even azelaic acid, they're all very good for brown marks and they also help the acne. So try a combination, and sometimes we see that one chemical suits one person and another chemical suits another person. So you do have to try and find out the one which actually works best for your skin.
Okay, all right. I want to add to this question, how to layer these actives together?
Yes, this is a very important question, and people tell me that, well, I've used a cream in the morning, do I have to wash it off? Now, believe me, all the new products that are available in the market, they are self-absorbable. So, all the active ingredients in any gel, be it retinoic acid or niacinamide or whatever you're using, within half an hour, they have been absorbed inside the skin. Now, all that is available on the top of the skin is the vehicle, which may be petroleum jelly or it may be beeswax. Now, these are part of the natural milieu of your skin and there is no need to wash it off. So, yes, you can layer, but at least give an hour between two products so that the active ingredient of the earlier product is well absorbed. I wouldn't use azelaic acid and arbutin together. I will use them morning and night. So I would use arbutin in the morning and azelaic acid in the night. There are some products that I would like to point out which actually don't do very well with the sunlight. They get oxidized into chemicals and they irritate your skin. Azelaic acid, Tretetnoin, these are the two main, benzoyl peroxide. These are the 3 or 4 main products which we don't want to be using during the daytime.
Okay, all right. So the next question is, I have a very bad dandruff problem and it's been there for years. I don't have it all over my head. I have it on the area above my forehead, because of which the volume of my hair in this area is low, and the area above my neck. I've tried almost everything, but nothing seems to work. Please help.
Dandruff is a major problem, and I would like to, before going to the question, answer a few simple facts about dandruff. Dandruff can be 2 types. One is the wet and sticky, which is very common in the rainy season, and the dry and the flaky, which is very common in the drier months like the winters in Calcutta. Now, the dandruff that we see in normal population, which is non-sticky, which means that if you comb it, it comes off, or if you have a shampoo, it reduces. But there is another kind of dandruff which is sticky and which is actually part of a condition called psoriasis. So, I would like to first see a patient and then decide whether this is the normal dandruff or is this part of something called psoriasis, or another medical term, I'm sorry about that, seborrheic dermatitis. Now, once I'm sure that this is not a type of skin condition, like as I mentioned, then we have dandruff. Now, my honest opinion about dandruff is that this is just sticky cells which are on your surface of the scalp. They are not a problem. They will not cause hair fall. They will not cause any infection. Only time they cause an infection is when you pick it or when you use excess. My take on dandruff is that there are 2 types of dandruff that I need to actually differentiate. One is the normal dandruff, which is non-sticky, and the other is the dandruff which sticks and which is a part of a medical condition like seborrheic dermatitis or psoriasis. Now, I would first talk about the normal dandruff which we have, which might be flaking of the skin. This is basically cells of the scalp which are sticking together and which are visible to us. So, we are always exfoliating, but when the cells stick and we can see, that is what dandruff is. Now, treatment of dandruff per se is very simple. We use an anti-dandruff shampoo, we rinse the hair and the dandruff tends to go away. But as Michelle was telling me that sometimes patients do have dandruff which is sticky, and which actually is part of the seborrheic dermatitis. In those cases, it's very important that the yeast part, the fungus part, is looked into. Antifungal treatments are prescribed. They can be shampoos, they can be lotions, they can be creams, and even antifungal tablets sometimes are required. So it's very important actually to be able to find the cause of the dandruff and then treat accordingly.
Okay. All right. So, doctor, if you're treating dandruff, how often should one shampoo their hair?
I say at least twice a week or even sometimes thrice a week. But it's very important how to use it. The dandruff shampoo that we give is not meant to be used on the full length of the hair. It is meant to be gently massaged on the dry scalp, leave it for 10 minutes and then wash it with your normal home shampoo. So that is very important, that the dandruff shampoos that are prescribed medically are not to be used on the full length of the scalp hair. Is only for the scalp and the skin and the roots of the hair rather than the full hair. That is very important.
Okay. All right.
So the next thread of questions read as follows. I have a textured neck and I guess the back of my neck is starting to darken nowadays. Is there anything I can do for this? The second part is, I have those tiny bumps that I mentioned earlier on my back and on my upper chest and a little above my breasts. What shall I do? And the next point reads as follows. I have slightly flaky skin on my earlobes and now it's spreading to my jawline. My ears have also started being itchy, not very much but slightly nowadays.
So I can find there are three threads here. One is that you get bumps. The bumps which are on the jawline, on the upper chest, on the back. Now these bumps could be a type of acne which do not have any opening, and they can be a type of whiteheads, or they could be some tiny cysts which can be found in these areas that you are talking about. After that, you have talked about the textured neck, which means it's darkening. Now that darkening is very typical, especially if there is a weight problem. For example, there is something called acanthosis, which causes a textured darkening of the neck and which can be treated with some hormonal manipulations. So you should actually see a doctor and get some checks done, thyroid, insulin levels, blood sugar levels, etc. And that should generally take care of the textured neck. Also, you have mentioned about this flaking in the scalp, flaking in the ears, coming to the jawline. I feel that this could be some form of a seborrheic eczema or psoriasis, and certainly you should see a doctor to make sure that there is no fungal infection which is lurking about, very common nowadays, and best to see a doctor for that.
Thank you so much. So it's quite enlightening. In fact, this entire session is very enlightening. Okay, this is also about dandruff.
I have a severe dandruff problem which stays on for almost the whole year. I have tried so many products and home remedies, but nothing is working really. I had also consulted a few dermatologists before, but it didn't work out for me as well. And now I'm losing a tremendous amount of hair. This is so scary. It will be great if you could help me.
Yes, so we have discussed dandruff in the past, and this is a good question for me to illustrate a few points in dandruff management. So yes, dandruff is treatable and it should be treated, especially when it's causing hair fall. So it's very important not to over-treat normal dandruff, and it's also very important to treat dandruff when it's causing actually a physical problem. So when you are getting hair fall, which means that dandruff is inflammatory, which means that there is inflammation at the roots of the hair, or the hair follicles are now inflamed. Now how to get this inflammation under control straight away? Because what you don't want is this inflammation to cause damage, permanent damage to the hair follicle. So what I would suggest is that you should certainly see a doctor, a dermatologist, or a doctor who deals with skin conditions, and get some steroid creams. The steroid creams short term are very useful to control the dandruff inflammation. Once the inflammation is under control, you will need some yeast protection. For example, you will need ketoconazole shampoo or clombazole preparation, which can be leave-on. So this is important, is that shampoos are wash off, the soaps are wash off, but there are some leave-on products which are now available for dandruff problems and treatment, and it can be left on overnight and works quite well. So it's very important to take care of the inflammation and the yeast overproduction to get this dandruff under control. Once the dandruff is controlled, your hair will regrow. Dandruff problem does not generally lead to permanent hair loss. Permanent hair loss has other causes, but dandruff is certainly not one of them.
Okay, so the next question is, I was wondering if you could discuss over-the-counter retinols for beginners with the dermatologist.
Thank you for that. That's a book in itself, but I'll try and précis it for you. Now, for me, retinol is a very interesting chemical compound. In the practice that we do, I would say that there are 3 or 4 which are the ones which we are aware of. But there are many, many more retinoid compounds if you ask a chemist or a scientist. The ones we use commonly is retinoic acid, which is Tretetnoin. Then we use something called adapalene, which is a milder version of retinoic acid. Then the third is something called retinal, which is the aldehyde version of the acid. And the fourth is something called bexarotene, which is another retinol, but used for more serious medical conditions. So I would try and fix myself on the retinal part and the retinoic acid part. There are 2 types of retinoic acid which I am going to talk about. One is the retinoic acid and the other is a retinol. Retinoic acid is something we use in acne, sometimes in a type of psoriasis, or sometimes in some form of eczema also. But the retinal is the one which is very, done a lot of press work. There's a lot of talk and chatter in the social media about retinal because of its anti-aging properties. Now, retinal is now readily available, for example, in many concentrations. The ones that are actually being known to work long term is retinal 0.15%. However, I have actually had occasions to see patients bringing in retinal 1%, 2%, even 3%. Now, this is getting into some dangerous territory because these high strength retinal can cause skin irritation, and we have actually seen burns as well if left overnight. So I would say that if you are going to use a retinal product, stay with retinal 0.15% or lower, which is safe, proven, long term. However, in our clinics, we do go up to 3% as a short term chemical peels. So which is okay, but we do run into trouble once in a while, and we do have to treat skin irritation when we use higher concentrations. So that is my take on retinal for everybody.
Okay, can I add to this question? Does adapalene have any anti-aging benefits?
You see, it's the same molecule. Adapalene has been used as a spot remover, wrinkle corrector, skin tightening agent, but adapalene does not have long-term studies. For example, I can tell you my experience is that we have used adapalene say for 6 months or 9 months in patients with chronic acne, chronic skin damage, chronic acne scars. But I have seen that after say 6-8 months of constant adapalene, the patients tend to get irritation, skin thinning, and then they can't use it. So long term still gold standard is retinol 0.15%.
Okay. The reason I was asking this is because, of course, the skin takes adapalene a little better, right? I mean, the irritation doesn't happen, the peeling doesn't happen.
Yeah, you see what happens with retinoic acid also is that when it's absorbed, then it has its action. But part of it, say 0.10% or something, it stays. It doesn't get absorbed, it doesn't get removed. So then that accumulates. So in retinol, the body is able to remove the retinol completely once its job is done. Whereas with retinoic acid and with adapalene, there is some amount of cumulative toxicity. Cumulative toxicity means that you're having alcohol every day, your body is able to flush it out. But over a long period of time, the alcohol will take its toll. So, that's called cumulative. It's a part of it is accumulating, like cumulative interest. So, your part of it is accumulating in your body, and over a long period of time, then you start getting thinning, and then the blood vessels come up on the skin, and that aging, then the skin thins out, and that actually is counterproductive.
Right, exactly. I think there was a question that was quite similar to this.
So the questions are, it would be great to know about beginner-friendly retinols, and also heard that Tretetnoin and prescription retinoids result in imbalance of menstruation cycle. Please let me know if this is true. Also, throw some light on the side effects of retinoids apart from peeling and drying, if any.
Certainly, to our knowledge, there is no connection between menstrual cycle and retinoids. Retinoids is a type of vitamin A. So they do not have any hormonal imbalances that they create, and we have used retinol for many years, and none of them have any problems with menstruation. However, I will just put this in context. For example, there is a condition called PCOS where the patients themselves have menstrual problems, and in these patients we will obviously use retinol or retinoic acid for acne, which is part of PCOS. So sometimes when their PCOS is getting worse and they are using retinol, they think it's a retinol which is causing the menstrual problem, but in fact it is the PCOS which they already had which was getting worse.
I have PCOS. I've been using adapalene and I feel like it's been great. Of course, lifestyle changes and stuff. I've stopped eating gluten, I've stopped having lactose, I've stopped all sorts. But like my cheeks are fine now. Before I used to have horrible cystic acne. It was devastating. And now I just have one pustule. I'm very happy with a pustule. I'll take a pustule over cystic acne any day. Any day. But the Venusia and the adapalene combination that you told, it has been working. I am so happy with it. I'm so
Fingers crossed. Don't think too much. You'll stop working from tomorrow morning.
No, not at all.
Okay.
I mean, lifestyle changes, of course.
Of course.
I've been so happy.
Staying on the same topic, the next question reads, I was wondering if I can use Tretetnoin or adapalene as anti-aging products on alternate days.
Tretetnoin is a very good drug for treatment of acne, fine lines, and it works very well short term. But as an anti-aging, as the word itself suggests, we are going to use something long term, over years. And I don't think that Tretetnoin would be suitable long term. And you're much better off with the other molecule, which is retinol, long term.
The next question is regarding pigmentation. So the question is what to do to lessen the spots and the darkness around the eyes, and are anti-pigmentation serums effective?
Yeah, it's, around the eyes pigmentation is very difficult to actually first find the cause and then find the treatment. So if it's genetic, then it's very difficult to treat, because we do see mothers coming with their daughters saying that, I have pigmentation around the eyes, I don't want my daughter to have it, can you do something? And the short answer is no, we can't do anything if it's genetic. But if it is something, say for example, due to a condition. For example, there are some skin conditions which can cause pigmentation. That certainly can be treated with treatments like steroid creams, pimecrolimus creams, or sometimes vitamin K cream can help, which is a very important new discovery, and we have found some good results with vitamin K creams. Also, we have found that retinol sometimes helps to take the pigmentation away and gives a rejuvenating look to tired, aging eyes, especially with bags underneath the eyes. So it's a combination of a pigmenting agent, depigmenting agent, say a retinol, and sometimes we do some treatments like HIFU or laser, which can take away the puffiness and which will take away the shades that we say which are around the eyes.
Okay, so it's all right to use retinol around the eyes, is it?
Retinol can be used around the eyes.
Okay, because I used to always wonder that, you know, if retinol is anti-aging and they're saying don't put it around the eyes, then I'm like, what about the crow's feet? I used to always wonder.
No, there are some retinol. Retinol is actually not irritating. Retinol is the softest. It is much softer than your adapalene. Okay. And it does not stay, so it doesn't cause irritation.
Oh, so there will be no purging?
No.
Oh, that's lovely.
Yeah, retinol is 0.15%. We have had studies on retinol with 0.15%. If you go above that, then again they will then accumulate. Okay. So, you know, this has been tried over like 20 years. So, we have got good data to say retinol can be used around the eyes. If you use like Tretetnoin around the eyes, within 7 days you will start feeling that tightness, and then the
flakiness and itchiness.
Also, retinol can be used.
Okay, that's nice. That's really good to know.
Okay, so the next question is how to repair the skin barrier.
The skin barrier is a very delicate balance where the pH is the most important criteria to maintain the barrier of the external damaging influences and the skin, which is a very delicate organ. Now, the skin barrier is maintained with a film of lipids or a fine film of oil on our skin, and if that's broken, then the skin barrier is broken, then the damaging particles like the pollution, the soap particles, they can enter and cause damage to the skin, which is called dermatitis. Now, it's very important to maintain this oil film on the skin, and to maintain it we need to maintain the pH balance. So, now you will certainly know that lot of creams, cleansers, soap products, bathing products are pH balanced. I would like to mention one term which is called Syndet. Syndet soaps, Syndet shampoos are now available. They are pH balanced with the pH of the skin, and they would actually help not damage your skin barrier. So, it's very difficult to repair a skin barrier, but it's easier not to damage it, because the skin barrier can be restored by the nature, by our own body, if the damaging influences are stopped. So, that is about the skin barrier.
The next one is how to smoothen skin colored small bumps on skin, may be called milia or comedones.
Milia to an extent is natural. They are actually when the skin is trying to repair itself and the repair goes a little awry and you get these small tiny blisters on the skin. It can be removed with exfoliation. So, you can try gentle exfoliation and it can be removed. But if you want milia to be removed dermatologically, we do that, and it's with either a salicylic acid chemical peel or with something called needling or something called microdermabrasion.
The next question is, after moving to Dehradun, my hair feels dead and falls a lot. My hair and scalp were already fine and dry. Now they feel barren and it falls like crazy to a point where I feel that my hair is thinner than a rope. My skin was clear, but now I'm getting so many pimples and the texture feels so bad. I really don't know what to do with either of them. Please help.
Yeah, I mean, I would like to take this as a general question of people who are moved from one place to the other and finding problems with their health, especially in terms of the hair and the skin. Now, it's important to know that we do have a body clock, and the body clock is according to seasons. If you have a sudden change of location, then the body clock changes, there is hair fall cycle is triggered, and you will get hair fall more than you expect for that time of the year. But it does take a year, and the hair fall will then regulate itself and then come back to the cycle for the new place where you are living. So that is not something which is uncommon. Now the fact that your hair feels lifeless and dead, I think it could be a question of diet, because the diet is very important in hair, and the important ingredients in hair for diet is biotin, iron and protein, which is very important for keratin. Now, it may be that your diet has slipped a bit when you have moved. It may be that your iron levels have gone down in your food, and that might cause these problems. So, it's important to take a check, improve your diet, your lifestyle, wait a bit, and you will see that things have improved. See that your diet is up to scratch with your protein levels, your iron levels, your biotin levels, so that you get good nutrition for the hair. After that, if you're still not having good hair growth, or the head is falling lustreless, there may be a question where you need a medical checkup. For example, we know that thyroid, we know that anemia, we know that diabetes, all can have a significant impact on your hair growth and hair texture. So, it's good to see a doctor and say, well, do you think anything needs to be done, maybe some tests to make sure that you are not deficient in some nutrition, vitamins, or that you are not developed a new condition which needs treatment. So, I would certainly advise that for hair which has suddenly turned not as good as it was before. So, yes, again we do find this, that people who move to Calcutta from say Chennai or Mumbai, they come here and have a breakout. Now, this is very common because the Calcutta weather is certainly more humid at times, the heat is intense, and there is possibly more pollution, and these are all factors which might play a role in development of breakouts. And certainly I think it might be that you need a better cleanser, or you might try and use a regime which is slightly more oil control, and you might find that the breakouts have reduced. If not, then the usual causes of acne have to be ruled out, for example diet, behavior, lifestyle, maybe some weight issues. Weight gain is related to diet, period issues are related to diet. So, a whole lot of factors can be part of your breakout.
The next question: how to get rid of hyperpigmentation due to keratosis pilaris? I have struggled with keratosis on my butt, arms and thighs. I do exfoliate and moisturize, but the hyperpigmentation is substantial. It makes me feel really insecure. Any suggestions how to get rid of it? Also, any recommendations for a good body moisturizer for KP prone skin?
I'm glad this question was asked, because we do have a lot of people with keratosis pilaris who come to our clinics very agitated, and they do want some treatment. Now, keratosis pilaris, as you must know, is a genetic condition which is limited. So, it's not going to spread all over, but wherever it is, like the upper part of the arms, the thighs, the buttocks, it may be persistent. Now, we don't have a cure, and that is a fact, but we certainly have control, and the most important word here is urea. So, if you have a urea based moisturizer, you can use it on your wet skin after gentle exfoliation, and that should take care of the major spiky keratosis pilaris. However, some people do have associated hyperpigmentation. And for that, I think, you need some creams like exfoliants, which will help take the top layer off and give you a little bit of a pinkish skin. Or if that doesn't work, then we have used lasers in selected cases with very good results. So it's a question of trying out the urea cream, a moisturizer, exfoliants, and if that doesn't work, then maybe see a dermatologist and see if we can help you in some form or the other.
Alright, so the next question is using apple cider vinegar containing moisturizer good for acne prone skin?
Yeah, there's a lot of talk about apple cider vinegar. Yes, apple cider vinegar has got some properties which are helpful for all skin, actually, not just acne prone skin. And the two things that we say that it has is, one is antioxidant properties, and secondly it has got an antimicrobial property, which means that it takes away the bugs which promote or worsen acne. So certainly apple cider vinegar has been found to be useful in serums, in toners, in face washes, even as leave-on products, and we do use it from time to time, and it certainly helps in mild to moderate acne, not in severe acne, but certainly in mild to moderate acne it's helpful.
The next question is, can we use azelaic acid and niacinamide at the same time?
Azelaic acid and niacinamide can be used at the same time. Well, when I mean same time is in the same person, but at different times. One in the morning, one at night, and preferably azelaic acid to be used in the night.
The next question is how to avoid stretch marks.
Yeah, the stretch mark question is very important, because the best way of treating stretch mark is to prevent it. Prevention is certainly better than cure where stretch mark is concerned. However, if you have stretch marks and you need treatment, then we do break the stretch marks into two types. One is the red ones and the other is the white ones. So red ones means there is some inflammation, and we will give some anti-inflammatory creams to reduce the redness, and then it might be less conspicuous. However, the white ones are the ones which are chronic and which cause problems and are difficult to treat. My general advice for stretch marks is that use a good quality virgin olive oil before bath as a gentle massage on that area, and then use silicone based creams like which are now available as anti-stretch mark creams, and they can be used for mild stretch marks. However, for the bigger stretch marks which are deeper and sort of gutting into the skin, then you will need lasers. So that is the few treatments that are available for stretch marks.
And the next question is how to use azelaic acid in post-inflammatory hyperpigmentation in photosensitive combination acne-prone skin.
Azelaic acid is best avoided in patients who are photosensitive, because azelaic acid itself is a photosensitizer. So we should avoid it, and even if the skin is inflamed, then we should avoid azelaic acid. But azelaic acid by itself is a very good anti-acne, anti-pigmenting agent. But it has got its limitation. More than 10%, 15% can cause irritation even in normal skin. So best avoided if the skin is compromised, according to me.
And the very last question is, are there any alternatives to minoxidil for baldness during pregnancy?
In pregnancy, very few chemicals are allowed, and certainly minoxidil should not be used more than 2%, which can be sometimes used. However, for baldness during pregnancy, you can use some peptides or growth hormones which are available as serum, and it can be used during the pregnancy time.
Alright, so with that, we're wrapping up this video. Thank you so much, Dr. Agarwal. If anybody wants to contact you further, I'll leave your website down below. If you want a consultation, then you do online
Yes, we do
consultations?
online consultations. All the numbers are there in the website.
So once again, thank you so much. This has been truly enlightening.
Thank you.
And hopefully we'll have you again.
Hopefully, yes. Thank you.
Thank you so much, Dr. Agarwal, for giving us your precious time, and we would love to have you again on the channel. To all of you who stuck it out till the end, thanks so much for watching, and I'll see you in the next one.